As I was saying yesterday, the term sickle cell disease is not a confusing term. It is a genetic term agreed upon by the World Health Organization. When you go on Facebook or even when you look in textbooks, the term is used loosely. And the meaning attached to the term is the meaning the person speaking attaches to it, but this is wrong. Sickle cell disease, WHO, as I said, is defined as, and I've got to repeat it every day, the possession of two abnormal hemoglobin genes. The genes that a person with sickle cell disease has must be abnormal, both abnormal. One abnormal gene from father and the other abnormal gene from mother. If there is just one abnormal gene plus one normal gene, this is not called sickle cell disease. Please repeat that. If there is just one abnormal gene, as it was in the case of my father and mother, they did not have sickle cell disease, even though they had abnormal genes, one each. But they gave the abnormal hemoglobin genes to three of my siblings, two boys and one girl. All three of them had abnormal genes from mama and papa. To stop the confusion about this definition, I simplified it by saying that every human in the world has two genes for hemoglobin formation. Both are supposed to be normal hemoglobin genes, but in every community, you have abnormal hemoglobins. You have abnormal hemoglobin genes more in African communities than you have in European communities. But every community, every group of people, members have some abnormal hemoglobin genes. So I call normal hemoglobin gene NORM, N-O-R-M in capitals, and abnormal hemoglobin gene ACHE, A-C-H-E in capitals. So the definition for sickle cell disease is not arbitrary. It's not an invention. It's not my invention. The only invention I can be blamed for is to call a normal hemoglobin gene NORM and an abnormal hemoglobin gene ACHE. So that is my invention. So my father was NORM ACHE and my mother NORM ACHE. And when they have children, they would pass on either the norm hemoglobin to one child or the ACHE, not both. So those of us who had the ACHE from father and ACHE from mother would become ACHE, and they had sickle cell disease. Now today, I have someone who will prove that the textbooks are wrong, saying that sickle cell disease patients die by the age of 25. I have here an achiever. He was at our first sickle cell disease patient achievers in London in 1993. And he was also in Ghana, the second sickle cell disease patient achievers in 1995. His name is Ebenezer Tego. in spite of his being egg, inheriting sickle cell gene from father and sickle cell gene from mother, and becoming SS, sickle cell disease SS. He is over 60 years old, and he is a professional pharmacist, and he has worked in UK teaching hospitals in the Department of Pharmacy in the hospitals. So I want to introduce those of us struggling with sickle cell disease, and please do not get offended at the term sickle cell disease. It is a genetic term. If you have two abnormal genes, one of which is sickle cell, you have sickle cell disease. So this is a sickle cell disease patient who has achieved. And I would like to ask him to speak for himself so that he can encourage those who think that when you have ache, or you have two abnormal hemoglobin genes, you should forever be in hospital and not be able to study and not be able to achieve and not be able to do wonderful things. Now, Ebenezer, which of the tribes of Ghana do you belong to?
That is Gan.
You are Gan.
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 Yes, Gan.
Gan. We knew in our communities about sickle cell disease before Herrick saw the sickle cells in the blood in the year 1910 in Chicago. We knew that those who had hereditary cold season rheumatism in Gan or Krobo or Tree had a disease which their parents didn't have. So I would like you to tell us how the trajectory, as it is called in the tribe, how it manifested itself in you, and how you came to know me, and how you had gone on and you were advised to marry somebody who is norm, so that none of your children would have ache, because your wife would only give norm to the child, and you will only give sickle to the child. So, however many children you have, they will be norm ache, like your father and mother, or my father and mother. So, please, when were you born?
I was born 6 March 1957.
Oh, Independence Day.
Ghana Independence Day.
You were born on Ghana Independence Day.
Yes,
Shake hands
the exact day.
So you are now 60 years, 4 months, and 5 days.
That's correct.
Right.
And yes, during that, during time, I was kind of like, say, back in Ghana, young, and been experiencing the sickle crisis, which over there they refer to as Tutwetwe in our Ghana language.
Yes.
I wouldn't say from the age, say, birth to like, say, 3, I could recall much. But what happened is from age 3 to 5, this is when, if I cast my mind back, I could say the moment my mom or my dad hear from there or there that that Tutwetwe can be cured, they rush to it. They spend money here and there until when I was 5, which I can remember very well. Then that is when they started a clinic at the Korle Bu Teaching Hospital, which I could remember. And that clinic was started by Dr. Konotey-Ahulu. So I remember my parents having to take me to the Korle Bu. In fact, how the whole thing started was I was admitted in the medical ward. And from that period, this is when I got to know Dr. Konotey-Ahulu, because I think in some way your dad, at later time, which I was told by my mom and dad, that your dad was the reverend at the time for the Presbyterian church at Laro.
Labadi.
Yes, Labadi,
Correct.
if I can remember that. And then you diagnose me as a sickle cell after having to go through
The test.
the test and
So-
things like that.
So it was I who
It
diagnosed
was
your
you.
ache as SS
That's correct. You.
using your parents.
Yes. And the test was conducted on myself and my late brother,
Your late
Daniel.
brother, Daniel
Also
SS.
access.
Yes. There, I want to add something. In our tribal languages, there is difficulty in explaining that to treat a disease does not mean to cure a disease. So in our languages, we shall say macha hela.
Mm-hmm.
But in
correct.
English, you can either say, I will treat the disease or I would cure the
The
disease.
disease.
Now, hereditary disease
Mhm.
cannot be cured, but
That's
it can
correct.
be treated.
It can be treated.
The only way, really, to cure it
Mm-hmm.
is to remove the factory, the bone factory of the blood from you and put somebody who does not have it in. This is what is called bone marrow transplant.
Mm-hmm. Mm-hmm.
But
Yes.
because 34,000 babies are born in West Africa every 3 months with sickle cell disease, with ache.
Mm-hmm. Yes.
To talk about bone marrow transplant or stem cell transplant for 34,000 babies who are going to end up with sickle cell disease is impracticable. This is why the way we manage you to be able to achieve is important. How did we manage you? Not to cure the disease, but to treat it.
That's correct. Yeah.
How did we do that?
And I mean, I remember during my early stages, like say that was back in Ghana. I was admitted to the hospital, and it was a raining season. And with the rain, and at the time, what we referred to over there as Chicheche, as our parents, they all kind of aware of. During rainy season, and when the rain started, and this is when, if you have the ache, you tend to experience aches, which is the pain. As we all know today, the crisis pain, which starts in the joints, and at times, you tend to feel it even in the stomach and things. And this was sent me, this was sent, I was admitted in the hospital. That is myself and my brother, because during that period, we were both kind of like, say, ill. And I remember we were in the medical ward at the time. we were under the care of Dr. Konotey-Ahulu. Now, Professor Ahulu, I never knew I would have come to meet you here in the UK as well after, all that. So I remember being given transfusion during that period, and I had to go and exchange blood transfusion as well, which at the time I didn't know much before I got into pharmacy practice, and then I got to know all these bits and pieces. I was kind of like, say, like, a blood taken up first from me, and then
Something. Yes.
I mean another.
Quite. This is important because blood transfusion itself can cause sickle cell crisis. But there are circumstances in which that should be done. And the best way it is done is, as you have said, partial exchange transfusion, which is in my book. I describe how it can be done, not with a machine, but at the bedside. Pages 416 to 417 in my book show exactly how it should be done. It can be done at the bedside with a nurse. You sit down and you do it. But the thing is this: have you been regularly transfused as they do in the UK and USA? Not every 6 weeks as they do.
No, not really. From time. Anyway, I moved into this country when I was 16 years.
16 years you came to the UK.
Yeah,
and you are now
to
60.
continue my education and everything.
Mm-hmm.
The time I came here, my first crisis which I got was about, like, say, after 6 months or a year after, because I did arrive in this country during the winter period.
Mm.
So within 6 months, I started experiencing the crisis.
Yes.
because
of the cold.
At the time, I don't kind of, like, say, understand the disease into details. I don't know what to do, and I was kind of, like, say, most of the time in the cold, standing at the bus stop. I wasn't following what I should, and I end up in hospital, and this is Central Middlesex Hospital, and I was under a doctor by name Dr. Brozovic. She is the hematologist consultant at the Central Middlesex Hospital at that time. So I could remember during my first admission over there, I went under blood transfusion and was given some saline and glucose infusions as well, which, if I could remember fairly well. Anyway, from that period, I think I stayed in hospital for some time, about, say, getting to 2-3 weeks, discharged home. And then after, like, say, 6 months or so, I started to experience, and that was my first kind of, like, say, blood transfusion in this country.
In this country, I see.
Yeah. And I'm talking about time I was 16 years
17.
old.
Yeah.
So getting to 17, I did experience stomach problem, which later was found out to be gastric ulcer.
Mm-hmm.
So I had to go into hospital, and again I was transfused after the surgery, which, with that is fairly understandable.
Yes.
So from that period, I also stayed in hospital for some time. So I remember when I came continuously, within, like, if I could put my mind to it, because I suffered priapism as well. And during the time of the priapism, the same thing, I went under a minor surgery, which also I was transfused. From this period, if I could, like, say, put a calculation to it, from the 16 to the age, like, say, when I turned 19, I was under Dr. Brozovic at the Central Middlesex Hospital, and I went. But then, when I was doing my A-level at Harrow College, I started to work with a pharmaceutical processing company they call Regent Laboratories. They make amoxicillin and things like that in Park Royal, just right opposite Central Middlesex Hospital on the Acton Lane. And this is starting to make the medicine. I cast my mind that this is a kind of a thing I wanted to study, because already I am doing biology, chemistry, and mathematics at college. So from that period, I took more interest in the sickle cell problems. And then during that time, as I said, I was under Dr. Brozovic at the Central Middlesex Hospital. A young lady started to work over there, a nurse, a staff nurse by the name Elizabeth Ahulu. Now she's Professor then Elizabeth Ahulu. She started over there, and she kind of, like, say, got so much interested in the sickle cell anemia disease and the thalassemia. So this is when she decided to form the Sickle Cell Society to help with the counseling of sickle cell patients in the community. So during this period, this is where I got involved as well, and I started to learn a bit about the sickle cell. And then having to go into pharmacy school, Nottingham, and then coming back and working with the hospital, I took so much interest in that. This is when my management of my own disease, the sickle cell, which I suffered from, started.
In other words, you began to rely on yourself.
That's correct.
Yes, you told us something in one of the Achievers conferences, which surprised everybody. You said you had not had a sickle cell crisis for, you mentioned the year, 20 years or 25 years.
Yes.
Because you had been drinking 4 liters of water a day. I'd like you to explain that.
So anyway, I mean, like I said, not to prolong the story, I took interested in it. I started to listen to my body.
You took
So
charge
I
of
know
yourself.
I took charge of myself. I knew when, like, say, I am gonna get into the stages of, like, having crisis.
Now,
I know.
this is important because from experience of the thousands of patients that I had seen, there is hardly any time that somebody had a sickle cell crisis without a precipitating cause. The textbooks say, oh, you can just have a crisis out of the blue. But there's always, in the case of my younger brother, who was fantastic at football, at soccer. He would be wonderful on the soccer field in the afternoon. At midnight, he would go into sickle cell crisis. That was the first time I realized that exercise can tip somebody into sickle cell crisis. I had patients who refused to stop smoking, and they ended up in sickle cell crisis because the lungs should be full of good air, and they were filling their lungs with tobacco fumes. I had a civil servant who went into sickle cell crisis when he became drunk. And in fact, he had a heart attack one day, New Year's Day, when he became drunk. Therefore, precipitating causes of sickle cell crisis help you to look after your body.
That's correct. Yes.